So on a national level, leadership has decided that vaccinations should be done in tiers. And tier 1, 1A, 1B, 1C, tier 2, etc. And the people who are at the highest risk for acquiring the infection and dying from it should get it first. So hence the first phase of the rollout was prescribed to frontline medical workers. And then it was felt that the highest rate of death were among patients over 65 and 75 in the nursing homes. So hence those people were included in the next phase. And then the third phase would be anyone over 65. And then the fourth phase would be other frontline workers like teachers, food service, grocery workers, agricultural workers. So we do it in tiers so that the people with the highest risk of death will get it first. So that's the program that's rolled out. The vaccines are distributed to the governors, and then the governors decide on how it's distributed to the counties and the cities. Part of the playbook that was released online from our CDC website is that patients with a risk for complications and death to this disease will be included after the 65 age group. So it would be anyone with a chronic respiratory illness, anyone with hypertension, diabetes, on hemodialysis, patients with chronic illness in general, and anyone that their physicians think should get. There are so many other medical conditions that we can't list them all, but if a physician feels that this person getting the infection will put them at moderate risk for progression and death, and hospitalization and death, then those patients will also fall into the next tier. The two vaccines, Pfizer and Moderna, the biggest preservative that's been spoken about is the pegylation compound, polyethylene glycol. If you have a severe allergy to that, you shouldn't be given that compound. And a similar compound is with the Johnson & Johnson vaccine as well. But in any event, anaphylaxis is the worst side effect. And during the administration, we observe patients for 15 minutes, and we have countermeasures if the patients develop anaphylaxis. So it's relatively safe, and it's given in a very safe protocol environment. The original studies of the vaccines did not include pregnant or breastfeeding. In general, we defer to the physicians overseeing the cases to recommend, but the goal is to get as many people vaccinated as possible. Generally, when we have questions regarding a vaccine, usually we don't give vaccines in the first trimester. That's when the fetus is growing and it can cause problems. But any question after the first trimester is generally safe. But I have to defer that to the physicians attending those cases. The Pfizer vaccine had studies up to 16-year-olds and up. Moderna had 18-year-olds and up, and the Johnson & Johnson 18-year-olds and up. So for now, 16-year-old is the earliest that we can give. There are now studies being done in children, and we'll have more information going forward. If you look at the number of hospitalizations and deaths in children, in people under age 18, it's less than 2.5% of all the total hospitalizations and death. It's a little bit opposite of influenza. Influenza affects children very badly. They get hospitalized and there are deaths with influenza. With the adults, it's not so severe. For COVID, it's the opposite. COVID affects children, but they don't get hospitalized and leads to death. But in the adults, especially the elderly, anyone over 75, you get hospitalized and death is really high. Is there anyone who shouldn't get the COVID-19 vaccine? Anyone with severe allergy to the components of the vaccine should not be getting it. Another group of people who shouldn't be getting the vaccine is someone with active COVID infection should not get it within 2 weeks. You should wait until your infection is over, usually 20 plus days, then you can get the vaccine. And the reason why we still recommend you getting the vaccine, even if you've had the COVID infection, is because the natural antibody that you develop, we think it's only good for 3 months, whereas the antibody you develop from the vaccine is longer lasting, more durable. So it's more advantageous to get the vaccine, even if you've had the the natural wild type infection.